Erie County Health Commissioner Dr. Gail Burstein is back with us to talk about how county programs are dealing with the fact that 20 million new STD infections will be diagnosed in the U.S. this year. That's unfortunate, to say the least.
It is. And I think many people think that sexually transmitted infections are just nuisances and it's among promiscuous individuals. Well, those are not true at all. First of all, we know that sexually transmitted infections are very, very common, and you can have be in a monogamous relationship, but your partner could come in with a sexually transmitted infection and transmit the infection. Most people don't have any symptoms who are infected with a sexually transmitted infection. And even though there are no symptoms, for females, they can cause a lot of irreversible damage. For example, chlamydia is the #1 cause of tubal factor infertility. And we've seen decreasing rates of tubal factor infertility as we've started screening females routinely for chlamydia and gonorrhea infection who are sexually active. And this really affects young people under the age of 25. So it's really important that people are aware of the health services that they should be receiving, and if they're not getting them, ask for them. To have a test for gonorrhea or chlamydia, all you have to do is pee in a cup. It's just a urine test, so it's not invasive at all for females and for males. There's no painful swabs. So it's for HIV testing. It could just be a swab of your cheek and inner cheek. It's just these are very easy tests to do. Yeah.
Doc, are there any more groups that are more affected by these than others?
Right. So as I mentioned, young women are very affected. We see a lot of infection that usually doesn't have any symptoms, and the only way they're going to know that they're infected is if they have a test. Also, we see a lot of infections among men who have sex with men, and it's because just within those sexual networks, there's a very high prevalence of disease. And so if you're in a population where there's a very high prevalence of disease, say like 20% of people in that network have, say, chlamydia infection, you're going to have a 1 in 5 chance of being exposed and infected, compared to if you're in a social network where there's no disease. I mean, you could actually have many partners and never get infected in those instances.
And it's important for people to know that many are curable, all are treatable.
Right. And so many of the sexually transmitted infections are curable, and if that's why we want to diagnose them in time before they cause any long-term damage. Some other sexually transmitted infections that are viral, your body's immune system may have difficulty clearing the virus, but there's medication that you can take to make the virus kind of go away and hide somewhere, in your body and not cause any symptoms. But some sexually transmitted infections can, come out. These viral infections can come out later and cause a lot of damage, like human papillomavirus. It's a #1 cause of cervical cancer and anal cancer and throat cancer, especially among males. So, some sexually transmitted infections like HPV and hepatitis B, we have vaccines so that people will never develop those cancers.
Want to remind everybody too that, of course, we have the Erie County STD clinic is at 608 William Street, and that provides confidential testing and also free and low-cost testing.
Right, and treatment too comes with it. And so if you're concerned, like I'm not sure what happened last weekend, I better get checked out, go to our 608 William Street clinic. Or if you want to start a new relationship with somebody, and before you start having a romantic relationship, you can both go to the clinic at the same time and get tested, and if either of you have something, you can get treated and start your relationship on a clean slate.
Let me ask you this: how soon would it show up on a test that you have been affected?
Well, it depends on the test, because all the tests use different technology. Say for gonorrhea and chlamydia, It can show up within 24 hours.
Really?
These tests are super, super sensitive.
Wow.
Yeah, these are like extremely sensitive tests.
Wow.
So other tests that are, based on your body's antibody response, like HIV or syphilis or herpes, those can take several weeks for the antibodies to develop a high enough level to be able to detect them.
Now, if you're just going to your gynecologist for a regular exam, can you ask at that office to have these tests?
Yeah, I mean, you should, you have to be your best own health advocate, right? And so if you're a female who's sexually active, who's ever had sex and under the age of 25, you should definitely ask for those tests. If you're older than 25 and you're concerned, you've had a new partner or, multiple partners, you're not using protection, you might be worried about what your partner's doing, come in and, ask your provider for one of those tests. I mean, again, it's many times you just have to pee in a cup or get a swab for your from inside your mouth or give a little bit of blood. It's not a big deal.
Right, right, and so it's just a matter of getting yourself taken care of because you don't want to harbor these kinds of viruses for a long time because, like you say, this could actually show up later on in years, and you don't want that kind of devastating news. So you want to just kind of handle this while you're going for routine testing by all means.
Right. I mean, again, gonorrhea and chlamydia can cause tubal factor infertility, and because when even though women may not feel any symptoms, there's still a lot of inflammation in the pelvis. There can be inflammation in the fallopian tubes and in the uterus, and then after that chills out, there's scars left, and that can block the eggs from, getting to the right place when a woman wants to become pregnant.
It seems like syphilis has been around as long as mankind has walked the earth. Do we not yet have a cure for that?
Well, it is easily treated with actually just penicillin, but the problem is that, again, many people don't have any symptoms.
Yeah, they don't know they have it.
And unfortunately in the United States, we're seeing a resurgence of congenital syphilis, where women are infected with syphilis during pregnancy, and they don't find out until, and they may not find out until very late in the pregnancy or not until labor and delivery, and the baby is born infected with syphilis, and that can cause huge bad outcomes for the newborn. It can affect their brain, it can affect their liver, it can affect their bones and their teeth. I mean, it's it's very, very serious. It's actually it can be a major cause of miscarriages. So it's really important that that people are tested appropriately.
Absolutely, absolutely. All right, let's give you some information. You'll see the number right at the bottom. Anyone who is sexually active can get an STD. Have you been tested? You can call Erie County's clinic, and there's the number at the bottom of the screen. But be your own best advocate and get your answers on things like this. Doctor, thank you so much for coming in.
Sure, thanks for inviting me. And I know it's like this is like kind of stigmatized in diseases, but people shouldn't feel ashamed. I mean, there are 20 million other people that are struggling with the same issue.
Same situation.
You're not alone.
Thank you so much for the good information. And remember, there's plenty of clinics here in Western New York to help you with this.